Your heart age can be older than the rest of your, or older than your actual age when you possess any of the risk factors that lead to cardiovascular disease. One of the most common is high blood pressure or being diabetic. Yes, especially in the older population, people older than 50 or 60, we see that because generally, we see problems arise like high blood pressure, diabetes, high cholesterol as we age, from women as we've gone through menopause, those type of things. The higher heart age results from having any of the listed risk factors for the Framingham Heart Study. So if you're diabetic, you're automatically at 20% higher risk. If you're a smoker, if you have high blood pressure, if your cholesterol is high, those type of things will elevate your heart age older than your actual age. Yes, the heart age is not related. In general, we're actually looking at the risk factors for cardiovascular disease. So I don't generally take people who have had a heart attack or known cardiovascular disease because the risk would always be high. So we're looking at people and trying to catch things before we have a heart attack or cardiovascular disease diagnosed. That will depend on what the risk factor is. If you have high blood pressure, then we want to try to lower that either with the help of a physician or on your own. If you're diabetic, we want to try to control that. If you are a smoker, we want to try to quit smoking. So if you possess any of those risk factors, we walk through it in the Women's Heart Center on ways to try to change that either on your own or with the help of a physician. Knowing your numbers is the key. Risk factors for cardiovascular disease are not things that people generally feel, and so you can have those risk factors and not even know they exist. Things like high cholesterol, even high blood pressure, it's called the silent killer, because people can have really elevated blood pressure and not actually feel anything. We've caught people who are diabetic, and so possessing any of those risk factors can make a big difference. It's called the Heart Health Assessment, but it's basically the Framingham Heart Study, and it's in a color form, and so we're actually able to look at ways risk factors that you may possess, but one of my favorite things to do is actually back out of those things and correct them and look at them in perspective of your physician has fixed this for you, whether you're on a medication or you've done something with your diet and exercise, and then we can back out of it a little bit and look and see this is what your risk factor could be if you were able to manage these things. Calcium scoring is a 5-minute CAT scan, and I refer patients for that based on certain parameters. If you are over 55 as a woman with one or more risk factor, over 45 as a man with one or more risk factor, then we refer for calcium scoring. Like I mentioned, it's about a 5-minute scan. It looks at the coronary arteries and it evaluates risk. It does not evaluate blockage, but it evaluates risk. Plaque, when it first starts to develop, is soft, and over time that plaque can actually calcify, and we can pick up that plaque on that CAT scan and make referrals to assess whether you do have a blockage by doing other diagnostic testing. Man over 45, woman over 55 with one or more risk factor. If you're under that age, we will make a referral if you have 2 or more risk factors. Those are things like early family history, high blood pressure, diabetes, smoking, high LDL, which is the bad cholesterol, or low HDL, which is the good cholesterol. We've had a lot. We've had over 15 patients who have needed bypass surgery. We've had over 100 people who have needed stents, but I always think some of the most success is catching those patients really early on. And so if we can catch those risk factors really early on and eliminate the need for a stent or the need for a bypass, those to me are the really great success stories, is catching things at a very early stage. It's huge. Like say, if I mentioned before, if you don't know your numbers, you don't know how to fix things, you don't know there's something that you need to fix. And so getting that assessment done, it's so easy. It takes about 45 minutes. And so we make it pretty painless. And you have to know what those risk factors are. Heart disease is 80% preventable. And so you really need to know what those risk factors are to be able to make those changes.